Hi, it's Lynn from lynnjt.com. Thank you for tuning in for this third episode in our 4-part series, Creating More Awareness on Cancer in Children. In our last episode, Verity explained the various types of treatment that children can go through whilst fighting cancer, and today she's going to give us an insight into the side effects that they're going through so that we can have a better understanding and are able to become better at supporting the families, our friends, our family members who are going through this. We talked about the 3 types of treatment. What are the side effects of chemotherapy?
Chemotherapy, it starts off usually quite gently. Sometimes, some chemos, the child reacts straight away, so they have to tweak it. And each child will have a slightly different makeup according to how their cells are responding and their bodies respond to it. So it's never one particular treatment. They'll use one particular drug, but tweak it so that each individual can respond to it.
Okay, so that means they might have different types of side effects. What are the most common side effects?
Nausea is the main one, and reluctance to eat, no energy, huge loss of weight. Have to put a nasogastric tube down to keep the child eating. Sometimes even have to put a tube into the stomach, straight into the stomach, and you feed the child through a syringe straight into the stomach, because they won't eat anymore. It changes all the taste in your mouth, and it feels like you're eating concrete. It's horrible. And they do get a huge amount of sores as well. In their mouth. And that can go all the way down the GIT tract, so that they're in pain when they eat.
So not just during the treatment, but throughout, in between treatments.
It gets worse and worse as the treatment goes on. That's why they have the rest, the 2 weeks rest every so often.
And you can't see these things, like the way that the taste is affecting them and their sores and their mouth.
They tell you you can see the sores. They look sometimes the whole mouth goes, because of course you've knocked out the immune system by giving the chemo, so they're very susceptible to any sort of infection, just like that.
And does their hair always
within
fall
hours.
out? Do you see that?
Not in every child, but most children. It'll come in clumps, which is often very distressing, so you need to cut the hair short. It's better to cut it short.
Is that distressing for the child or just more for the parents?
No, for the child.
For the child,
they hate
as
it.
Well.
Yeah.
They do, okay.
Yeah. Some children feel much better wearing a wig. Others won't touch wigs because they're hot and difficult to wear. Mm.
And what about the side effects for radiotherapy?
Well, there you get the same sort of side effects: nausea, vomiting, continual vomiting. Oh, and diarrhea as well, with both of them. I forgot about the diarrhea. Not fun when your child is 6 months old. Ooh. And yes, it's the lack of energy, the not being able to eat. It's a similar scenario. And often radiotherapy can give you severe burns, 3rd-degree burns, just on the place where it's been directed at. There's creams and things you can put on, but you have to wear loose clothes and give an awful lot of analgesics, painkillers.
Mm-hmm. So again, it's a painful process.
It's painful. Okay. It hurts. Mm.
And surgery, of course, there's the fears that come along with the surgery and the build up to it, but after doing, how do children recover from these types of surgeries?
It's usually good because they're young, and even though they've been absolutely mullered with drugs to suppress the immune system to help combat the cancer, they will get up and run around and stuff, and so after surgery they're much better than grown-ups at moving around and getting on with it. In fact, you have to restrain them a bit. Sometimes the stitches burst because they've been riding the bike or something and they shouldn't have done.
Anything else? Any other symptoms or like side effects?
Some children go through chemo and go through radio, no problem.
Okay, so this is not every case. It really depends on the dosage of drug, how that child is doing and their type of cancer and what stage they're at.
Yes, so and how strong their bodies are. It's astonishing. Some children you wouldn't even know were ill. They don't lose their hair, so you need to remember that.
And
along with all the dreadful scenarios, there are some really positive things in there.
Thank you for watching, and please show your appreciation for Verity's message by hitting the like button and sharing it with your friends. Now, don't forget to subscribe to this channel and make sure to watch the last episode in this 4-part series where Verity explains how families can become quite isolated, and it might seem that they don't want to have you and your children over for play dates, and there's a very good reason behind this. Thanks for watching, be safe, and I'll see you soon.